No stroke. Community outreach and the education. Martha Power FNPC, Dania Smith FNPBC, Angela J. Schaffer RN.B. Stroke Smart Reduce, Stroke Risk Recognize, Stroke Symptoms. Respond, at the first sign of stroke. Call 911 immediately. Why people don't respond to stroke symptoms. Don't recognize symptoms. Denial. Think nothing can be done. Worry about cost. Think symptoms will go away. Fear or don't trust hospitals. Perceptions of stroke myths. Reality: stroke is not preventable. Stroke cannot be treated. Stroke only strikes the elderly. Stroke happens in the heart. Stroke recovery ends after 6 months. Reality: up to 80% of strokes are preventable. Stroke requires emergency treatment. Anyone can have a stroke. Stroke is a brain attack. Stroke recovery can last a lifetime. Stroke facts: a leading cause of death in the United States. 795,000 Americans suffer strokes each year. 134,000 deaths each year. From 1996 to 2006, stroke deaths fell by 18.4%. 6,400,000 stroke survivors. Stroke facts: a leading cause of adult disability. Up to 80% of all strokes are preventable through risk factor management. On average, someone suffers a stroke every 40 seconds in America. The cost of stroke. The estimated direct and indirect cost of stroke was $73.7 billion in 2010. The mean lifetime cost of ischemic stroke per person is about $140,048 in America. Types of stroke: DIA, ischemic, hemorrhagic, transient ischemic attacks. Warning: strokes or mini-strokes, blood clot, vasospasm, etc. occurs for a short time. Symptoms resolve in 1 to 24 hours. Indicates possible major stroke in the future. 1 in 9 will have stroke within 3 months. Ischemic stroke caused by a blocked blood vessel in the brain. 8 out of 10 strokes are ischemic. Risk factors for ischemic stroke: hypertension, diabetes, heart disease, smoking, high cholesterol, atrial fibrillation, history of previous stroke, age, obesity, poor diet, lack of exercise. Ischemic stroke symptoms: facial droop, slurred speech, dysarthria, difficulty swallowing, dysphagia, expressive or receptive aphasia, gaze preference, weakness, numbness, loss of sensation, symptoms on one side of the face or body, visual changes or loss of part or all of vision, confusion, reduced or loss of consciousness, vertigo, dizziness, ataxia, nystagmus, wiggling eyes. Call 911. TPA, the clotbuster. TPA is recommended for treatment of ischemic stroke in selected patients. However, TPA is only administered to less than 3% of ischemic stroke patients. Delay in seeking medical care contributes significantly to underutilization of TPA for stroke. Extending time window for TPA administration beyond the current recommended 3 hours might be beneficial. TPA recommendations: TPA should be administered to eligible patients within 3.0 to 4.5 hours after stroke. Eligibility criteria in this time period are similar to those for persons treated at earlier time periods, with the following additional exclusion criteria. Age greater than 80 years, oral anticoagulant use with INR less than or equal to 1.7, baseline NIH stroke scale score greater than 25, a history of stroke and diabetes, for the 3.0 to 4.5 hours window. All PEEPs receiving oral anticoagulant are excluded whatever their INR. 3/25/2017 Copyright 2009, American Heart Association. All rights reserved. Information from the expansion of the time window for treatment of acute ischemic stroke with 40 PA-Science Advisory. Mercy clot retrieval device. Mary clot removal video 110. http://u2.b/mgx7ifkhc. Penumbra device and restored cerebral circulation. Penumbra clot retrieval video 145. http://u2.b/lifesngluck. Solitary vascularization device. Solitary vascularization device video 143. http://u2.b/0dqpd5tts5y. The latest in neurointerventional radiology. Brain attack. Stroke is a brain attack. Stroke happens in the brain, not the heart. Stroke is an emergency. Call 911 for emergency treatment. The term brain attack is the most descriptive and realistic description of a stroke. It also provides a powerful call to action. A brain attack should warrant the same degree of emergency care as a heart attack. After all, your brain is your mind and your body's most vital and delicate organ. Immediate response is crucial because every minute matters. From the time symptoms first become noticeable to the time treatment is received, more brain cells die. In other words, time is brain. The best thing to do is to call 911 for immediate assistance. Treatment is available and some options are most effective if administered within the first 3 hours after experiencing symptoms. Your chances of walking out of the hospital with little to no disability are greatly improved if you receive appropriate treatments early. Unfortunately, it takes the average American 12 to 24 hours to get to the hospital after experiencing the first stroke symptom. This is why it's important that everyone learns how to recognize stroke symptoms and how to respond. References: National Stroke Association, The Complete Guide to Stroke, 2003, at http://www.stroke.org/site/docs/nsa_complete_guide.pdf. Dosage equals 341. Lichtman J.H., Watambui, et al. Hospital arrival time and intravenous TPA use in U.S. Academic Medical Centers, 2001 to 2004. Stroke, 2009 /40-00200. 20. Carotid artery stent. Carotid endarterectomy. Case study: What do you do? A 59-year-old male working at his desk. He sends a coworker an email that does not make sense. He is confused, has a left facial droop, and his left arm and leg are weak. He is on Coumadin for an irregular heart rhythm. He has no other medical history. He says, "I am not going to the hospital, because they can't do anything for me." What do you do? Case study continued. You call 911 and your coworker is rushed to a primary stroke center emergency department. The stroke team meets him at the door, and after imaging, diagnose him with an acute RMCA stroke with a large penumbra. Case study continued. He takes Coumadin for a trial fibrillation, but a blood test and the fact that he arrived so soon after onset of his symptoms meets criteria for him to receive PA, the clot-busting medication for stroke. His stroke symptoms completely resolve with that PA. When he returns to work without any neurological deficits, he thanks you for calling an ambulance and getting him medical treatment so quickly. Hemorrhagic stroke, caused by a ruptured blood vessel in the brain. Risk factors for hemorrhagic stroke: hypertension, bleeding disorders, aneurysm rupture, vascular malformation, excessive alcohol use, cocaine use. Hemorrhagic stroke symptoms: focal neurological deficits, headache, worst headache ever, neck pain, light intolerance, nausea, vomiting, decreased level of consciousness. 2 categories of hemorrhagic stroke: ICH, bleeding into brain tissue as a result of bleeding or rupture of a small, deep cortical artery that is damaged by chronic hypertension. SR, subarachnoid hemorrhage is the result of bleeding into the subarachnoid space, most often in relation to ruptured aneurysm or AVM. Aneurysm clipping performed by neurosurgery. Incision and removal of skull bone. Surgical clip prevents blood from entering aneurysm. Coiling procedure for aneurysm, performed by neurointerventional radiologist. Catheter guided to aneurysm site. Coil is packed into aneurysm. Blood no longer enters site. Associated with improved outcomes. Stroke recovery: 10% of stroke survivors recover almost completely. 25% recover with minor impairments. 40% experience moderate to severe impairments requiring special care. 10% require care within either a skilled care or other long-term care facility. 15% die shortly after the stroke. Lifestyle changes for survivors and caregivers. Daily living skills. Dressing and grooming. Diet, nutrition and eating difficulties. Skin care problems. Pain. Sexuality/intimacy. Behavior. Depression and anger. Emotional liability. One-sided neglect. Memory loss. Communication problems. An example of left-sided neglect. Types of stroke rehabilitation. Physical therapy, PT. Walking, range of movement. Occupational therapy, OT. Taking care of one's self. Speech-language therapy. Communication skills, swallowing, cognition. Recreational therapy. Cooking, gardening. Well-known stroke survivors: President Gerald Ford, Teddy Bruschi, Sharon Stone, Della Reese, Kirk Douglas, Roy Horn, of Siegfried and Roy, Mary Kay Ash, Charles Schultz, Harry Carey, Charles Dickens, Ed Koch, Ted Williams. How to lower your risk for stroke. Stop smoking. Maintain blood pressure below 140/80. Keep cholesterol in acceptable range. Manage blood sugar if diabetic. Regular exercise. Low-fat, low-salt diet. Moderate alcohol use. Everything in moderation. Primary stroke care healthcare team. A dedicated stroke team coordinates stroke care, neurology and neurosurgery services 24/7. Cutting-edge imaging, CT, MRI, etc., 24/7. Advanced vascular procedures performed by neurointerventional radiologists on call 24/7. Specialty stroke-trained nursing care. Physical therapy, occupational therapy, and speech therapy. Follow-up care managed by neurology service. Support group, education, research, and community outreach. Healthcare team. Current research trials. Shine. Point. Clear ER. Stroke biomarkers. Pediatric stroke. Stroke support groups. Meeting for education, community, and healing. Women and Stroke AHA ASA Campaign 2. Increase awareness of cardio and neurovascular disease in women. Appalachian Stroke Network. A regional cooperative of healthcare providers coming together to improve stroke care throughout Appalachia. Act fast. Call 911.